finding a cure for migraines back in February. I've heard from people from around the country and virtually from every country around the world, or almost many countries around the world, seeking more information on this very, very serious topic. Tonight, a follow-up to our migraine surgery report. Word of mouth has drawn people from everywhere to our website to learn more about Dr. Bahman Guyuron's revolutionary approach to curing migraines. The Lyndhurst plastic surgeon discovered that by surgically trimming or eliminating nerve branches, chronic migraines end. Interest in this surgery is sky high since he is practically the only surgeon in the world performing this procedure, a situation that will likely change, though, as soon as his research is completed, which won't be long.
Ted, based on our studies that we have done, we have come to a very intriguing conclusion that not only what we do works, it also lasts.
Back in February, I profiled several people who have been cured of their migraines. Dr. Vieira Burnett, a medical doctor herself who had chronic migraines. Dr. Bill Prysock, another physician suffering from what he termed killer migraines. And Jody Cleary, my wife, who suffered from 4 migraines a week on average for the last 25 years. Today, incredibly, they are all migraine-free, and their stories have impressed others who suffer migraines. What goes on in this medical center at Lyndhurst has touched the lives of many people. So far, we have received over 1,000 letters from people asking about migraine surgery, and the reason for this is simple. 1 out of every 4 households includes somebody who suffers migraines. Jack Erickson suffered frequent and awful migraines. He detested them.
I've had them for 25 years, half my life. I'm 50. I've wasted my whole young adult life with migraines.
But following surgery, Jack's migraine days are now history. And the difference this has made for his wife?
Oh, huge difference. I mean, before, if you had a special function with the children or family or a wedding, you just hoped and prayed that he didn't have one. And then he'd get it. He out of half the month he had migraines, so what were the chances that he wasn't going to? Now, it's a new life.
Many Clevelanders who know of this procedure are convinced of its effectiveness, but others around the world still await the data that will come from Dr. Guyuron's completed research.
The skepticism of what Dr. Guyuron was doing is because it's new, and the scientific community is always skeptical until they see enough numbers to make the statistics and the N values as big as they need to see.
Neurologist Deborah Reed of the American Migraine Center screens candidates for migraine surgery. She signed on to participate in Dr. Guyuron's research after learning of his amazing results. And as soon as his next round of research is published by the Journal of Plastic and Reconstructive Surgery in 2005, Dr. Guyuron expects his findings will become universally accepted.
It has been done scientifically. It includes a large number of patients. It has a control arm, meaning that patients who served as a control, and we compared control groups to the patients who had surgery. And that's the way we can actually document what we're doing convincingly.
Those needing no more convincing, of course, are those who have already undergone Dr. Guyuron's dramatic migraine surgery. For them, the short time they spent in the operating room one day has opened the door to a whole new life, quite literally.
It's like being reborn. It's been 15 months since my surgery, and I've had no migraines. 0.
And there is one happy man. Dr. Guyuron's research could not only open the door to more and more migraine surgery, but it could also have a dramatic impact on medical insurance companies. He expects insurance companies will be more likely to cover this important surgery once his research is completed. You can email me for more information about this procedure. Email me at henry@newsnet5.com with your questions and or comments about this new life-changing procedure.
It is revolutionary. To go from having constant pain to being pain-free is just, for many of us, kind of hard to imagine what that must be like.
That last gentleman there, half his life now pain-free.
That's true.